Okay. Welcome, everybody. I'm Jonathan Roop. I'm the director of the Injury Prevention Research Center at Emory. And thank you so much for joining us for the next hour when we want to talk about the summer internship opportunities that our center and our partners are operating are offering. Next slide. So this is just a little bit of an overview of the agenda for today. I'm going to talk a little bit about the Injury Center and what we do. Dr. Hannah Cooper is going to talk about our summer injury research fellowship program and opportunities. Dr. Dorian Lamus is going to talk about the Scott Lilienfeld Injury Prevention Scholarship. I'll talk a little bit about our CDC placement opportunities, and then we'll talk about other summer internship opportunities. Next slide. So just to give you all a quick overview, IPRCE stands for the Injury Prevention Research Center at Emory. We are a CDC-funded injury control research center. And what that means is that we do research, education, and training and outreach to reduce the top causes of injury death. An important part of that is offering summer placements for students who are interested in learning more about the field of injury, violence, and overdose prevention. Next slide. Okay, so with that, I'm going to pass it off to Dr. Hannah Cooper to talk about our Summer Injury Research Fellowship.
Lovely. Thank you so much, Jonathan. And so great to see all of you. This is one of my favorite things to do every year is get to co-direct SIRF, the Summer Injury Research Fellowship. And I get to do that in my role as Research Core Director with IPRCE. This is also co-funded by SPARC at Emory, which is the Rollins Program on Substance Use Disorders. So we have been able to join forces over the past few years. So let's go to the next slide. So SIRF is designed to strengthen injury prevention and response within the state of Georgia and beyond, with the goal of training the next generation in injury prevention. And that next generation is you all. It consists of a 10-week paid fellowship that's done over the summer within a couple of branches of GDPH. And those branches, you'll be hearing more about the different placements in a moment from our wonderful GDPH partners. So I'll just tell you a bit about the logistics, but the GDPH partners are the heart and soul of this work and really a great pleasure to partner with. This is a full-time placement with GDPH. You have an agency mentor at GDPH, and then I would be your faculty mentor based at Emory. As your faculty mentor, I'll get to meet with all of you as a group, all the fellows as a group, every other week, and we'll troubleshoot, share learnings that you all are having. I'll also do some professional development work. And I believe that Stephanie has also created a more formal curriculum that she may be able to talk about with all of you in a bit. There's a written deliverable, and that's something that we have designed in partnership with our GDPH colleagues. And that written deliverable varies. It's often a report, it could be a presentation, and it's going to help you meet your practicum requirements. We do this over the summer. There's flexibility because I know people may have plans already, so there can be flexibility with the start and end dates, but it's 10 weeks of paid work. Let me go to the next slide. To be eligible for SIRF, you have to be a full-time master's student with a strong academic record, and you have to have at least one semester of coursework left at Rollins or wherever you're located. Doesn't have to be a full year, but it should be at least one semester. We're hoping, while we're building up injury-related expertise and knowledge, we do look for people to have some foundation in that already at the beginning. So that can be an understanding of the epidemiology of unintentional and intentional injury, knowledge of the impact of injury on health and society, and also the capacity to identify and apply public health strategies and principles. Let's go to the next slide. I'm going to turn it over to Stephanie, and I just want to take my hat off to Stephanie for creating all of these slides and for really ushering us through this process.
Thank you so much, Hannah. I appreciate it. And so with that being said, my name is Stephanie Verna. I am the Program and Research Manager currently at IPRCE. And just not too long ago, I was in your shoes and I was a SURF fellow in 2021. And I worked with our very own Tracy Reese on the Child Occupant Safety Program and the 55+ drivers with Liz Head. And so some of the things that I participated in and kind of developed as I was with GDPH, I researched a bunch of different messaging campaigns and dissemination strategies for seatbelt safety and car seat safety. I designed monthly newsletters for 55+ drivers in different types of scientific publications in the areas of transportation, bike, and pedestrian safety. And then most notably, my most favorite part was I designed a social media toolkit for Child Passenger Safety Week that was housed on the Georgia Governor's Office of Highway Safety website. I did use this as my APE, and so you are able to use this time if you do need an applied practicum experience. So it is something that you can use for that time. In addition, we've kind of put together a little curriculum like Hannah was mentioning. So just some things that we want you to get out of this that is going to make your time more valuable and just to get everything that you want out of your experience with Georgia Department of Public Health and with us at Emory and Hannah as your advisor. And so next we're going to talk a little bit more about the different positions. But I'm going to head it over to Tracy so she can talk about the mission, vision, and what we got going on for the positions available during your time with us at SURF.
I'm gonna let Liz do this slide.
Way to delegate up, Tracy.
I'm learning, my friend. Thank you.
You are. You should put that on your PMF. Good afternoon, everybody. Such a pleasure to be here with our partners at the Injury Prevention Research Center at Emory. I'm so glad that Anna took a moment and called out Stephanie for her work on this. I also want to take a moment, y'all. I don't think you understand what it takes, and maybe you do, but what it takes to put together this deck of slides or any deck of slides with a bunch of different presenters. And when we all have a lot of things on our calendars, somehow January has turned into Super Bowl month, literally, for everything we have to do. Tomorrow, I think my team is in 5 different places. There's only 3 of us. I don't know. So I just really want to thank Stephanie for her patience with all of us and getting all of this together. It's been really fantastic. Here at the Department of Public Health, within the injury prevention program, so the public health has a division of health protection, a division of health promotion, and we also have medical and clinical services. So we are within the health protection division, and we are a program within that division. Our mission, as you can see ahead of us, is basically it's to keep people out of the hospital and out of the morgue. And we want a state where their vision is met, so injuries and our burdens are minimized. And we do that a lot through empowering coalitions, through all the usual mechanisms, but really in that is partnership and creating a culture and a system that respects and speaks to every single one of these things around data and training and coordination and leadership. That's how programs get out. And our team runs across the entire lifespan. We've got safe infant sleep, we've got child occupant safety, we've got health for adults, we've got data that connects everything, we've got unintentional and intentional injury mechanisms, and we are 100% grant funded. So our interns have an opportunity to learn a little bit about each of those topics, while specifically being in one of 3 positions for injury prevention. This year we have a space on our child occupant safety project, are building our largest dementia infrastructure grant, or the BOLD grant, and our comprehensive suicide prevention grant program. Also within DPH as a whole, also within health protection, there's going to be a SURF intern position on the opioid and substance misuse response program. I think our next slide takes us into specifics about each one of these. Tracy?
Look how well you did. That is beautiful. Okay, so my name is Tracy Reese, and I am the program manager for the Child Occupant Safety Project. What we are going to be looking for this summer from our intern is going to be really focusing in on development of a survey of child passenger safety technicians across the state of Georgia. This is something a previous grant program did annually. We got a lot of good information. It helped us understand how the child passenger safety technicians were using their certification, how they were making impacts in their community. Were they using it only at work? Did they use it at home? How were those different spaces? Were you using it in this county where you worked or in this county where you lived? If those were different, and it helped us really drive our education and our outreach efforts, understanding where we may have gaps in services that don't necessarily show up with some of the other resources that we have in place. So we would be looking for our intern to really develop the survey. We have previous versions that we'll be able to look at to kind of see how they flowed, what information was there, but we will be looking for you to use that skill of developing a survey and evaluation for this. We'll be looking for a report out on that development results. And then we'll be looking to organize a webinar that's going to be working with some of our statewide partners, our stakeholders in this information. So our SERP intern will be developing that webinar, helping with the activities, with the scripts, with all of the information, really is going to be the lead on that piece of it, working with our team as we bring our partners together to look at these results and see how that impacts what we are doing across the state. Within this, our Stephanie will be the first one to tell you that we roll into our project with a focus here, and then inevitably in talking with you and in finding out what you were interested in, that expands and it opens up, and we are definitely we definitely want to hit areas that you are interested in. So we're game to have that conversation. Our team is a team of 13, and we've got folks all over the state. Kind of everybody's working on some similar projects, but everybody has a little something different that we can connect the interns with as well, to observe different activities that may be going on. So that's a little bit of a pitch for what COSP will be doing this summer and what we'll be looking for from our intern.
On over to Liz so she can tell us a little bit more about the second opportunity serve, our BOLD grant program.
Yeah, so the injury prevention program is on our second round of BOLD funding. It is a CDC opportunity essentially designed to bring public health into the fold of dementia and Alzheimer's disease work, treating dementia and Alzheimer's disease as it should be, which is as a public health problem. And how does public health contribute to the work that is happening on this set of topics? So we're in the first year of a 5-year grant, which is very exciting. One of the things that we are charged to do is have a partner networking meeting. Real-time adjustment. This is either going to be a partner network meeting, or it's going to be a series of smaller meetings centered around the work groups associated with the GUARD Collaborative here in Georgia, which is the voluntary group of professionals and advocates that work on the state plan for dementia and Alzheimer's disease. The concept is the same in terms of having some surveys for the groups that will be meeting as they seek to update the state plan for dementia and Alzheimer's disease and have a direction for the safety work group and their policy work group. So having the surveys around there will help us determine what the needs are, narrow down to specific focuses, and make sure that the projects that folks want to work on within these work groups are applicable both at the state level and at the local level, which is something new that's happening within the GUARD Collaborative. So the surveys, probably 1 to 3 surveys, we're sort of in the development stage. Our intern will help us determine the best number of surveys and help us work on the content for those surveys. in partnership with the people that'll be doing the work. Our second project is we are charged with hosting actually a series of webinars for professionals. This is going to be on topics related to the work happening in Georgia around dementia and Alzheimer's disease. So risk reduction, caregiver resources, and training and respite, as well as post-diagnosis care and living with this set of diseases. We need to be training and networking with professionals on these different topics. So we're going to be creating a webinar around this, which is complete organization of that webinar, because we've got to have training of several different types of professionals that are going to be working with this population. And so we need breakout rooms. We need to know what is happening and who is saying what. We need the speakers, and we need thoughtful, insightful discussion questions. So that'll be a huge project for our intern. And then, of course, we do have an opportunity sort of within BOLD, but not to do some data cleaning and mapping for Cardiff violence prevention data. Cardiff is a project out of Wales that was adapted here in the United States, piloted actually by Grady Hospital and the Injury Prevention Research Center at Emory. And it maps hospital screening data for folks that may have been injured as the result of a violent act in a public space. It also maps police data for violent acts that happened in public spaces. When you map those two things, you tend to see where there are injuries that resulted from violence, but with no police presence. And it gives us an opportunity for community level interventions. And so that data cleaning and mapping, we've just signed a brand new executed memorandum of understanding with Albany's Phoebe Putney Hospital. We also received data from the Albany Police Department. So this will be a brand new site to do mapping and cleaning of data. We're incredibly excited. We have people to help teach if you're not familiar with ArcGIS or with R for doing mapping. We can help teach you that. So don't be afraid of that for this particular experience. I think our next slide covers our next opportunity, which is for our comprehensive suicide prevention program. We were granted these funds in 2022 from the Centers for Disease Control. It covers several DAPs, or disproportionately affected populations, throughout the state of Georgia. So for this project, we'll have at least two main goals for our intern. There'll be some survey development and analysis from those responses for partner engagement, as well as the related programmatic activities. Literature reviews are going to be really important for this one, simply because there's a lot happening, and we want to be able to capture that and share it with our partners at the local level that are doing this work. It's not something that partners at the local level always get to do, and it's turned into a valuable resource that we've noted across our other projects. This particular opportunity is going to prefer candidates that have some strong quantitative and qualitative data analysis skills. If you happen to have program implementation experience, that would be really helpful. But as this is an internship, we will guide you every single step of the way. There's a great team of 3 on this project that are really excited to have an intern to work with them.
Thank you so much, Liz.
Thank
I
you.
appreciate it. Now I'm going to move on to our last opportunity, and I'm going to introduce Katie Casa, and she can talk about our opioid and substance misuse program.
Thanks, Stephanie. Hey, everyone. Good afternoon. My name is Katie Casa. I'm the program coordinator for the Drug Surveillance Unit, which is part of the Opioid and Substance Misuse Response Program at DPH. So my team produces data around overdoses and prescribing in Georgia. This position specifically will be working with our data source called SUITRS, which is the State Unintentional Drug Overdose Reporting System. SUITRS is a really rich data source that we compile and maintain. It includes information for all unintentional drug overdose deaths that occur in Georgia. And it has a lot of detailed circumstantial and toxicology information, and includes a lot of different data sources from coroners and medical examiners throughout the state that are compiled into one big data source. So this project specifically will be focusing on health equity analysis of fatal overdoses, and we're really looking to stratify by demographics and substance type and circumstances and look at the data in kind of a creative way that we haven't been able to before with a health equity focus. So this position will be working really closely with one of our suitors epidemiologists who understands the data source really well and can kind of help guide the analysis. So we're looking for a candidate with really strong quantitative data analysis skills primarily. What we use on our team is SAS and/or R. So if you're comfortable with either of those, that's great. And then a preferred knowledge of mapping software, and there are some qualitative fields in suitors. So if you're interested in qualitative data and have those analysis skills, then that is great as well. But really looking for those strong quantitative skills for this position. And we're really excited to have a student and to get this project started.
Katie, thank you so much. I appreciate you sharing all the things that they'll be working on, and we'll be looking at those applications. I just wanted to, I don't know if Hannah, if you wanted to take this or I can, which
Sure.
do you feel?
I can, sure. So just, looking ahead, the SURF applications are due in a couple of weeks. So February 9th, 2024. And then we'll move into interviews with the subset of applicants. We'll hold those interviews, end of February, early March, and that'll be interviews with GDPH leadership on these different projects. You'll specify which project you'd like to apply to. Then we'll kind of move on successful candidates to do reference checks. And you should hear back about placements by mid-March. And then we expect that you would start the fellowship in May or June. We do have some flexibility depending on any break plans that you might have, and then also mentor needs. Stephanie, can you, and this might be the next slide, but just can you say a little bit about the process of applying?
Yeah, absolutely. So I have all the links to all the things, all the applications that we have, and I'm going to put that in the chat. In addition, there is a link that is on our IPRCE website under student opportunities, and they are all Qualtrics for the most part applications that you will fill out and make sure that you have everything. Just remember, if you want to come back to that application, you're more than welcome. Turn on your cookies. There is directions on how to do that. And so you can gather all the things that you need to apply. There are varying deadlines, and we will go over these, but all this information is going to be in an email to everybody that did register. And I'm going to also send it out to all ADAPs as well.
That's great. And can you remind me, are we doing questions at the end after we've heard from all the different fellowship opportunities, or do you want to stop now and take questions on SURF?
We have time to take any questions right now if you would like, and we will also have time at the end perhaps to take questions. So you can either unmute or you can go ahead and pop it in the chat and we can answer if you would like. If not, we'll keep on chugging through and you can wait till the end. All right, we're marinating on what we need to ask, and I understand that. We'll have questions at the end, I'm very sure. And so with that being said, we're going to move on to the next thing about Scott Lilienfeld, and that is going to, I'm going to turn it over to our Education Core Director, Dr. Dorian Lamis.
Hi, good afternoon, everyone. Dorian Lamis, I'm the Director of Education and Training at IPRCE. I'm going to present a couple slides on the Scott Lilienfeld Injury Prevention Scholarship. But before I get into this, I think I should recognize that Scott Lilienfeld was a really prominent, well-known psychologist at our university in the Department of Psychology, who passed away of pancreatic cancer in 2020. So since then, we've named the scholarship after him. It's a summer scholarship and it's designed to recognize, assist, and train students working on injury-related research or practice-based projects. All of the projects have to have some applicability to the injury problem in Georgia. So violence prevention, dating violence, sexual violence, childhood maltreatment, suicide, youth violence. It just has to be centered within Georgia or within the southeast region, but we really want to focus on Georgia. There's lots of data sets that have been used in the past, so we can help you look for potential data to work with. Some other options are motor vehicle crash, prevention of traumatic brain injury, falls prevention, or drug safety. So essentially, this is a scholarship for the summer months to really hone in on a project to advance our understanding and prevent injury and violence in Georgia. So next slide. So the application can be found online under the educational opportunities on our IPRCE website. Excuse me. The application includes just a CV, resume, your project proposal, a letter of support, and the complete application form. Again, these are filled out online through our through the portal under the Lilienfeld Scholarship. The deadline this year is February 23rd. The scholarship includes a $2,000 stipend that will be distributed at the start of the summer to help you with your research. On the website, it says $1,500, but we are increasing it this year to $2,000. You'll also receive a scholarship certificate. There's lots of opportunities to interact with local injury control experts depending on what your topic is, and recognition on the IPRCE website. And following the completion of the project, we ask that you do a publication brief or presentation, which in the past has occurred at our quarterly meeting. But there's lots of information on the website, including review criteria, more detailed information on how to apply, as well as some of the previous summer Lilienfeld scholarships that we have. So again, the deadline is February 23rd. If you have any questions, feel free to email me directly. My information is on the website. I'd be happy to answer any questions. But a lot of most of the information you should be able to have answered through looking at the website. So thank you, and thank you, Stephanie, for again putting the slides together.
Okay, so I'm going to come back and talk about another program that our center supports in collaboration with CDC, which is CDC's summer internship program. So there are 10 injury control research centers. Each center gets to select an intern to work on one of 10 projects identified by CDC. So these are internship opportunities that we pay for, but CDC selects. So basically what we're asking is for applications for this. The application is for one of the 10 topics listed here. You can provide a preference, but what happens is CDC looks at application materials and tries their best to match applicants with particular programs. So, but there is not a guarantee that you would be matched with a particular program if you were selected. Regardless, these are incredible opportunities to work on some of the most important areas in injury and violence prevention. And the students that have been selected for these opportunities have universally reported that they had good experiences. You can see some of the areas. So for example, working on CDC's Whiskers tool, which is really their front-end data access tool for injury data, studying overdose resources in tribal colleges, evaluating the rape prevention education program. All of these things are really important and incredible learning opportunities. CDC also has their own exposure and training opportunities that are provided to summer interns. So if you were selected for this, expect to participate in that. Summer interns have also had the opportunity in the past to travel to the Safe States meeting and present the results of their work as an intern. Again, application deadline for this is February 5th. This is being driven by CDC. We will send out information, again, a summary information about the deadline, about these opportunities, and details for how to apply. Next slide. Okay, so in addition, since we wanted to do a single event where we advertised multiple opportunities, IPRCE partners were also invited to provide some of their internship opportunities. This slide lists some of them. The first of which is working on a project led by Dr. Brianna Woods-Jager, IPRCE's Associate Director, focused on in a project called Youth Empowered Advocating for Health. This is really sort of an equity-centered research project designed to help reduce violence in communities by enabling youth to advocate for violence prevention. The IV project, so interrupting violence affecting youth and young lives, or youth and young adults at Grady. IV is a community violence prevention project that's hospital-based. It focuses on identifying and proactively addressing the unmet needs of survivors of violence who are treated at Grady Memorial Hospital. This project has been wonderfully successful and is a great opportunity to connect with not only professionals working in violence prevention at Grady, but also the violence prevention infrastructure in the city of Atlanta. Moving on to our next opportunity, IPRCE as a center also supports a number of summer interns. These interns work on a wide variety of projects relevant to injury and violence prevention and overdose prevention. Some areas where we have interns work are on program evaluation, studying the impact of our research on health equity, and other research topics. Stephanie Verna is the contact information for that. Those positions are going to remain open until they're filled. We also have a position for an intern working on overdose prevention in support of our drug safety task force. So this position really would be working directly with Nick Giordano, who is the chair of the task force, and who has a particular project that he's soliciting an intern for. Applications for that are also due Friday, February 23rd. Next slide. Okay. So I also want to note that I am hiring 6 students to work with me directly on our statewide roadside observational seatbelt survey. The way this survey works, we want to characterize rates of seatbelt use, driver distraction, child restraint use, and motorcycle helmet use in the state of Georgia. We want to use this to drive injury prevention programming, as well as allocations of resources to address seatbelt use, driver distraction, child restraint use, and motorcycle helmet use. So each year I hire 6 students. They go into the field and learn about observational research. Each student can do this as a practicum and has the opportunity to use and analyze the data that they collect. So application details on the right. Again, I'm the supervisor for this. And just drop me a note if you are interested in it. Next slide. Okay, we do want to note that we have a couple of traditional IPRCE partners that also have internship opportunities. So the Region 4 Public Health Training Center, their website describes internship opportunities that they support. as well as our partners at the Children's Injury Prevention Program at CHOA, Children's Healthcare of Atlanta. They also fund internship opportunities. I believe Stephanie will include links to the websites here, as well as some application materials in follow-up email. So I think with that, we can pause for questions. I think there've been some in the chat. If there's anybody who wants to ask a question live, please raise your hand. We'll call on you and then you can unmute.
In the chat, I provided a couple of the different applications, but in the one-stop shop, I did put the IPRCE student opportunities link in the chat, and that has all of the different opportunities, where you would apply, a little bit more information about it, the deadline, and everything at that link if you'd like to go ahead and click on it. Sophie asked for SURF. In order to apply, we need to be a master's student, correct? Not necessarily, but we have had mostly master's and PhD students in the past. I don't know, Jonathan, if you want to talk about the undergraduate piece.
Yeah, sure. I think for some of the internship opportunities, undergraduates with appropriate skills and experience will be considered. I think the master's requirement is really just an acknowledgement that many of the skills that are required for these are taught in sort of master's level courses. You know, however, for example, for things like the seatbelt survey project, I certainly would consider a highly qualified undergraduate. And I think that's true for some of the other positions as well. So I'd encourage you to apply.
Absolutely. And a couple of questions that we usually get are most of these opportunities paid? And the answer is yes. Some of the opportunities that we did share on the last slide are not paid for, but however, there is information on how you can get more information to see if that is the best fit for you and your situation for the summer. In addition, we do have different positions, like I said, that are at IPRCE. So if you are interested or know people that are interested in injury and violence related topics and want more like knowledge and or work experience within these topics and evaluation and such, you're more than welcome to email me to see what we have available this summer. For any of these, also, there is the IPRCE email at emory.edu. You can email that as well to get any information. And anything that we didn't cover today, you can go ahead and go on the website. You can email IPRCE at emory.edu. Or Verna, that is me, at emory.edu. I'm the program and research manager to let you know a little bit more about you know, what we have going on and any application questions. Additionally, this is being recorded so that we can go ahead and put this on our website and or on our YouTube so that you can see this information later and apply, or if anybody was able, you know, not able to make it today, which is understandable, can get this information. Just letting you know that the first deadline, February 5th for CDC applications come up very quickly. And so I would advise to look at that one just with a little bit more will and get everything together to apply to those first. Just as a former intern looking for a position for the summer and such. Can you apply to multiple positions? Yes, you may. There is no constituent as to if you can apply only to one. You can apply to all or whatever interests you. Are there any other questions in the chat, or if you'd like to unmute and be brave, we can answer your question now. All right. I just wanted to thank everybody for coming and joining us for this session. And like I said, I gave you all the information. It will be emailed out with all of the links and who you can contact. Thank you so much, everybody. and I hope you have a great day. Let us know if you have any questions. Bye.